Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome, Nurse Converse Universe. It's your host, Dr. Tina, here again. I use she, her, ella pronouns. I am extremely humbled and grateful to be in community with my sisters, Sonya and Taloa, for this episode on Indigenous nurses, honoring the past, leading the future. As I've shared numerous times on my podcast, my platform is about amplifying the voices of those underrepresented. And that's exactly what we're going to do today, talking about Indigenous nurses, honoring their contributions, and addressing the unique challenges they face in healthcare. Before I have my guests introduce themselves, I want to read a land recognition statement that my sister Sonya has gifted to me, and I am so proud to share every place I can. So we honor our ancestors who were here long before America, recognizing their profound connection to this land. We acknowledge that Turtle Island, now known as North America, is the ancestral and unceded lands of Indigenous peoples who have stewarded this land since the beginning of all creation. We honor the rich histories, cultures, and traditions of our Indigenous relatives, including the Plant Nation, Animal Nation, and Sacred Elements Nation. We must pay tribute to the resilience and wisdom passed down through generations. Understanding their teachings illuminate our path toward unity and respect. Recognizing that we are all interconnected, we affirm our shared responsibility to respect and protect these relationships. In gratitude for the teachings and wisdom of our ancestors, we commit to fostering harmony and understanding among all beings, acknowledging that we are all relatives in this intricate web of life. Together, we strive to create a future rooted in respect, equity, and reverence for the land and its original keepers. And I'm so excited for us to get into why Indigenous representation in nursing matters. And so now it is my honor to ask Sonya Frazier first to introduce herself.
Hello, everyone. Hello, sister. Thank you for inviting us to be here today and for that beautiful introduction. Hello, halito. My name is Sonya Frazier, Sohushtiful Sonya Frazier, Chikasha Mecha Chatasia. I'm very grateful to be here in the sacred circle today. Thank you for asking us to be here too.
Thank you, sister. And Ms. Taloa Sharp, please introduce yourself.
Taloa Sharp. My name is Taloa Sharp. I am a board member at large of the Oklahoma Indigenous Nurses Association. Sonya gives me the title of co-founder, but she's the founder of that. Secretary of the National Alaska Native American Indian Nurses Association. Currently a student, master's program, psychiatric nurse practitioner program.
Yes, get it. We need it more than ever. So thank you and congratulations. And it's so grateful. Again, I'm so grateful to have you both here. So I want us to understand a little bit more about Sonya and Taloa. So I was hoping you guys can share a little bit more about your personal journey in nursing and also how your cultural identity shapes your approach to healthcare. And so Taloa, I'm going to switch it up and start with you for this one.
Me and Sonya had been working together at a tribal facility where we live. We didn't know for a while that we were on the same kind of brainwave. Kind of how we got together was through my son. We live in what's considered the Chickasaw Nation reservation area. In Oklahoma, there's 39 tribes. There's several different reservations, what they call reservations, allotted to that particular tribe's boundaries. So we live in the Chickasaw boundaries. When my son graduated high school, I thought it was understood because my son is Choctaw, Chickasaw, Cheyenne, Arapaho, and Lakota. So he grew up kind of in 2-3 worlds. He grew up my ways, which was not so much traditional, but on the language and how our spirituality coincides. It's with his dad. So his dad grew up more traditional in the sense. His grandpa, my son's grandpa, is a Cheyenne Arapaho chief. So I say jokingly that while I was with my ex-husband, like for 17 years, I was Cheyenne. We had we went to ceremony every year. So that's kind of the world that my son grew up in. So when it came time for him to graduate, we wanted to honor him in the ways that all of our tribes do. And to us, it was just something simple. It was a beaded cap for his graduation cap. I wasn't aware that the school had a policy against anything on their caps or on their gowns. So I respectfully went to the principal. They told us we couldn't do that. I just wanted to see if there was a compromise we could reach because the school resides in Chickasaw territory. And my son is several different tribes. He had graduated with honors and had represented the school in several different areas academically and the sports that he was in also. But so I went to the superintendent and it was very awkward, I'll say, because I didn't realize until then that this area and even bigger picture Oklahoma, basically I felt like they didn't know that we exist. They didn't know what it meant. It wasn't just a decoration. There's a lot of thought and a lot of prayer that goes into it. I had already asked my cousin who got his master's to bead his cap, and it was for a reason because I knew that he understood the purpose behind it, and he would pray as he did it because when we give things, there's spirituality involved with it. It's not just for decoration. So that's how big picture. That's how me and Sonya kind of came together because then the whole community started to hear about it, and we weren't even meaning for me and my son were kind of behind the scenes people, and it kind of made me aware of the action that needed to be taken. That it was time to step out of my comfort zone, assuming that everyone knew things that I knew, and they didn't. So around that time too, and I had worked at that facility for about 11 years, I think, at that time, worked in different departments, and it was on a day-to-day basis. People didn't know things. So they would go to the brown nurses if there were issues and things that they didn't know instead of educating themselves or until the facility provided some education, because we serve at this facility here not just Choctaw and Chickasaw tribes, but all tribes of Oklahoma, all tribes outside of Oklahoma. Anyone who's Native American or American Indian, they can come to that facility if they're a federally recognized tribe. So we had people come from Texas, from Mexico, from California, from South Dakota sometimes, but definitely that outlying tribes even here in Oklahoma. And we were having to explain a lot to the providers, the doctors, the physicians, the staff there. I feel like now when I look back at it, it's basic human etiquette. But I thought that everyone knew what I knew, and it wasn't that way. So then it just became like a kind of an uphill battle trying to gently educate people. And then we weren't in the place of authority to do that. So we were trying to find resources to give to the tribe, to give to the facility, and there was none. We wanted maybe a nurses association to reach out to. Hey, do you have any resources we could give for this tribe? Or do you have any resources we could give for this area of nursing that would help for better communication between the tribes and the facility and the providers? Because a lot of times we were the middleman and it wasn't a good place. But there wasn't one. So then me and Sonya started talking, and that's how the association came about, because we wanted to give other nurses a resource. So since then, she's no longer there. She's at another place that serves just the Native population. I'm on that kind of outskirts. I've been traveling for the past few years, but since starting school, kind of made my home at an outside facility, though. When I say outside, it's not a Native facility here in Oklahoma, but still there's all tribes that come there too, because we're in Oklahoma. There's 39 tribes here, and people still don't know things. So that's what we try to do. Of course, we want to uplift and elevate all of our voices, especially the ones that haven't had the visibility, but definitely for Native people. And we try to bring educational opportunities to different areas through our Nurses Association. And of course, we try to bring in more Native nurses because as it stands, we're still one of the most underrepresented groups in this country. So that's kind of our goals. That's kind of where I am, and even with my schooling right now, I write papers all the time about how I want to, or I intend to be in the native, serving the native population. But here in Oklahoma, it's a mixture of people. So we have to have a broad perspective. And I feel like being on the road has kind of taught me that, especially in California, because there were so many people, different people, and I loved it. Like learning about different religions, learning about different cultures. But especially here in Oklahoma, that's what our association tries to do, is trying to bring awareness to the issues that have brought the health inequities, like I learned at Summit, that because again, with Native population, we have still the highest rate of suicide, we have the highest rate of diabetes, heart disease, all of these health disparities, all these inequities. So what we noticed too is that it was being normalized. Because I remember asking one nurse, "Don't you get tired of seeing our people come in so sick, and it seems like it's happening at a younger age, and then they're dying at a younger age? What can we do about that?" But it was almost like, "Well, Taloa, why bother?" Like it's almost like it's okay. They're just native. If they come in, as an alcoholic, oh, that's just how they are, And then, of course, the saying that I wrote in a paper recently was that I heard a doctor say it, and I didn't know how to respond. So it's coming up with those responses, coming up, helping other people come up with their responses too, because a doctor in a Native facility had said, "Oh, these people get their medications for free, so why don't they just take them?" Well, number one, not these people. We have names. We're humans. We're not separate from other humans. So then the other thing is we didn't get our medication for free. It came by blood. That's how I see it. Because we have a unique relationship with the United States government. They were to provide health, education, and protection on the lands that they moved us to. And by no means did those things come for that. There was a high cost. It cost us parts of our culture. It cost us our people when we were removed from our homelands. So all of that ties into what we do, and we try to educate on, because there's a lot of people here, even in the state, that don't know those things.
Wow, sister, you just gave us so much right there to unpack. But a couple things that stick out is just the significance of the tradition, the thoughts, and the prayers that go into a graduation cap, right? Is significant. And how in that experience of advocating for your son, but for your culture, right? You were able to find strength in being uncomfortable with advocating. And now it's just flourished into so much, because I see you advocating and championing and fighting every place I go. So it's just amazing how that has manifested. You shared so much related to just basic human etiquette, right? Seeing us as human beings. And that unfortunately is something that I think is lacking, particularly in healthcare, but I think in the larger context, right? Society, like we just don't see each other as humans. And it's really, I think, critical for everybody listening to know that it's not always easy to speak up, right? And to challenge people's biases, but we have to do it, right? And for any bias that we are a witness of, right? Because unfortunately there's so many isms and so many biases that are out there. And it's a skill that hopefully gets strengthened the more that we are in community and are able to build on that. But I still, right, I've been through a lot of experiences, but I still have that like, oh, okay, I can't believe they just said that. All right, let me calm down first before I answer. But all right, I have to say something. And there's times where I even go to the group chat, like, let me tell you what they just said. Hold on. Right. So yeah, I just applaud you and am grateful again for your expertise and your passion. And so now, Sonya, hear a little bit about you in your journey and story.
All right. It's a long story, but I'll try to keep it short and sweet. So I'll just start with the OINA organization. And just like Taloa was saying, this all started with her son and Taloa advocating for her son, but she wasn't just advocating for her son. She was advocating for all of our children. Because my daughter was going to be graduating the following year. And I had already started preparing my daughter, that I was prepared to start advocating for her as well. You know, I was already looking into what I needed to do to challenge this. And then we found out about Taloa and Tully. And I told my daughter, I said, okay, we're jumping on this train. I said, because this is for us too. And I said, we got to be there all the way to support them all the way till the end. And that's what we did. And because just even that experience was really influential in what we do, because it has grown so much now. We've had so many people sharing their stories about what happened, how they didn't get to have beaded graduation caps. And the way I always explain what the significance of a beaded graduation cap is, we used to have ceremonies for our young people, kind of like a coming of age ceremony for them. And it was to allow their spirit to grow with their physical body. And these are ceremonies that were taken away from us during colonization. And so, you know, we try to indigenize what we can in this modern day. And that's one way that we do it. And just as Taloa was explaining, it's a ceremony. Once the individual asks someone to be their cap for them, it's a ceremony because it's an exchange. And there's just a lot of prayer that goes into it, a lot of time, a lot of thought that goes into the design. And it's just, you know, you're pouring love into what you're making. And we try to start with our young people. And that's one of the other things we've been trying to do with our organization, is to encourage our young people to go into the nursing profession, to go into the health profession, because we need them. Because as we all know here, representation matters. Because you know, our patients, they just feel more comfortable whenever there's a nurse or a doctor that looks like them and that understands their culture, understands, you know, their background. And even in all of our different cultures and tribes, you know, we have different ways we say hello. But the one thing I can tell you that all of our tribes have is a sense of humor. You know, we love to joke around, we love to tease each other. But yeah, it's just about educating and advocating for our communities, for our people. And as far as the OINA organization, the way that got started was just as Taloa was saying, we were looking for other Indigenous nurses, because we were like, we can't be the only ones going through all of this. We can't be alone. And, you know, the nurses were just like, well, go ahead and make it, you know, start it, get it going. And I've never done anything like this before. So I said, okay, here I go. And, you know, it's just, you have to kind of push yourself out there to be in those uncomfortable spaces where we feel like we don't belong, and then take your space. And that's what I've had to learn to do, is to encourage myself, you know, to be there, that you do belong there. So I reached out to different nurses associations, just saying, hey, you know, we're looking for an Indigenous Nurses Association. And the Oklahoma Nurses Association was the only one that replied to me. And she's like, hey, I've got these other nurses that are just asking the same thing you're asking. And she put us all in contact together. And that's how we created the board, and been going ever since. And it's just grown so much. We've been so busy, even though we're a small group, we're a powerful group, and we just continue to grow. And I just found out some other exciting news from another member, you know, what she has going on, and, you know, collaborating with her just to provide more scholarships for our Native nurses to help them be successful in the nursing programs, because that's what we need as well. And it's just thinking out of the box, being innovative. It's a lot of work, but it's worth it. It is so worth it in what we're doing, because we know every step that we move forward, we're doing something to help improve our communities, and not just our Indigenous communities. We're talking about all of our community members. And that's kind of what we do. And we welcome allies. We welcome relatives, really, and because we're all related.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
And actually, thankfully, you guys have called me and normalized me seeing each other as relatives, as we call each other sisters. And then another colleague of ours, Bart Bailey, calls us siblings as well. So I really love that evolution of the title, like allied to actually relative, right? Because when you think about your relatives, you're going to do everything in your power for them. So that's a beautiful manifestation there. I just, again, so much to unpack there as well. But what's really sticking out to me is how, again, you embrace being uncomfortable and stepping out of your comfort zone to take up the space that's deserved, and recognizing and advocating for your sense of belonging in all spaces. And so I just commend you on that, and really just want to share that with the listeners as well, is that if you see a need, right? If you see a gap, if you see space, fill it, right? Because there's probably more than just one person who's also feeling that gap and missing that. That's how Latinas in Nursing came to be, right? You know my story about one night I was looking for a book about me, for me, and I didn't find one. So I was like, all right, I'm going to make one. And I've kind of have used that example to be kind of my charge to everyone, but particularly to our youth. And you both spoke about the youth and how it's really important for them to not only know their history, but to also be active members, right, in forging the present, but also the future. So that's something else that resonated with me.
Yes, because I'm sorry,
No, go ahead.
but one of the questions that we get asked a lot in our organization whenever we receive new members is they find out that they are Indigenous or have Native American heritage, and they want to learn about their culture. But I always tell them to start with their creation story. That's a place to always begin, because that does give you that sense of identity of who you are and where you come from. So that's always a good place to start, is starting with your creation story.
Tell us more about that. What is the idea behind your creation story? How would one go about exploring that?
Do you want me or Taloa? Which one?
You go ahead.
Yeah, you take it. You take it, sister.
Okay. Well, because of my upbringing, it was kind of instilled in me early on. I know my dad, he was very, he advocated. I didn't know that's what he was doing back then, but he was advocating for me and my brother to be sure and learn our history, learn our culture, learn our language. And I regrettably did not learn the language as I should have, because he's a fluent Choctaw speaker. And, but the way I understand, when we know our creation stories, it just builds who we are, and we have that relationship with the land, because many of our creation stories begin with the land. And once we have that understanding, we see that land as our relative, as our first mother. And you're going to be more respectful and take care of the land and protect the land. And, with our beliefs, we believe that if you keep the land healthy, our people are going to be healthy. And that's why we see a lot of Indigenous people as environmental protectors, protecting the environment. And that's why they do it, is because that is our first mother.
Taloa, do you have a different perspective or more information to share in creation story?
Well, I feel like it just kind of ties into that kind of what we do, because even with our association, we wanted to, what we say, network. And I think Sonya had gone to a different training not too long ago, but I said it's kind of like trees, because I went for a walk a little while ago and it reminded me of that. Because recently I had a conversation with my husband about not chopping down this tree, because I said that tree is an old tree and it teaches those other ones, those new ones, how to withstand things so that they can grow. And that's, I feel like that's what we do too, because we had talked about, we network with people, we meet people, we learn from them, they learn from us. And you talked about your book, because then we don't even know we're doing it at the time. We just know that we're supposed to do that, and that's what we do. Because then recently she had someone reach out to her who said they were taking a different position or going for a promotion, or I think it was she was going for a director position because she saw the things that we were doing. And that's what we want, that especially with our Native people, I feel like sometimes it's just the showing up to do something. It's the hardest thing, because we have so much on our plate all the time. Me and Sonya, sister, we talk about it, like our families are big and we have things going on all the time. It just keeps on rolling, and we have to learn how to go with it. But yeah, it's that connection to the life around us that we need. We need that connection. That's why I went for that walk before I came on this, as to get my mind together, to get my thoughts together, and to get grounded. And then I was reminded about the conversation we had about the trees and the networking, and that's how they network, is through underground networking system. They teach each other, but especially the mother trees, they teach those older, the younger ones, how to withstand all of the seasons. And I feel like we're in a different season right now, and especially me and her, like, we have to show up no matter what's going on. We have to show up. We have to bring what we can. Sometimes it's I'm a hot mess express, and that's what I bring. So I have to definitely bring it back down and think about things but we all help each other stay on track. And that goes along, I feel like, with what she was saying about even our creation story, because it all goes back to our origins, and always being reminded, and constantly reminding ourselves too of the life that sustains all of us.
Oh, I love all that, and just how powerful it is that if our lands are healthy, right, then our people are healthy. And as has been mentioned, right, we haven't been doing a good job of taking care of Mother Earth. That has come through a couple conversations, and it's actually in the new ethics, right, our new nursing ethics with that. And I have to credit your expertise and your guidance in infusing that and making sure that was there present as well. So nurses, if you haven't read the new ethics, code of ethics, please get it. And also really pay attention to the call to our ethics to Mother Nature and to Mother Earth. I have one last question before we wrap up, right? Well, actually, maybe two questions. Sorry. This is just so good. I just want to keep on going. So I appreciate everybody staying with us to this point. One question and then a call to action that I want you guys to share to the audience and to the listeners. But the question I'm targeting to you now is based on, I guess, Taloa's last statement about how we have so much going on, right? And life be lifing. The season we in right now is unprecedented. And there's always, unfortunately, so many challenges, right? And barriers and obstacles that we have to overcome. And that's hard work. So in that spirit, what are you guys doing to take care of yourself, right? And to ensure that your wellness, right, is a priority. And I ask that because of the reality of nursing in general, right? Having not had that good harmony, right? We're often identified as martyrs, right? Like we just give until we have nothing else to give, but we know that's not right, and that's not the way it should be. But particularly as Indigenous nurses, where your burdens and your kind of challenges, right, are exponentially greater. than me as an Afro-Latina, than white nurses listening, or other privileged groups that are listening. So in that, again, what are some, things that you're doing to ensure your wellness is a priority? And we'll start with you this time, Sonya.
Well, what I am doing is I am taking time to rest. I haven't done that the past few years because I just keep going. And then my body shut me down. And so, I had to really take a long look and say, what do I need to do? And it's hard because you do have your family that depends on you. You have your community that depends on you. You have all these relatives all around that depend on you. And, you want to be there for each person that reaches out to you. And it just gets heavy sometimes. So we have to figure out a way to release that heaviness. And so this year I've committed to resting. And what I do is I take a hot bath and I just submerge myself under the water where I can just barely breathe. And I just listen to my heartbeat and I listen to my breathing. And I even set a timer to allow myself to be in there 30 minutes. And I've let my family know that this is my time.
Good for you.
Do not come in here and try to talk to me or sit down beside the tub and talk to me. No. And I'm thankful because I can hear my husband outside the door, leave mom alone. But I have to have that time. And I chose the water because that's also a healing element. And so as I'm laying there submerged in the water with my eyes closed, I just start praying, for all the negativity, all the heaviness, all the requests that people have made of me, that I have given all that I can, and that as the water drains out, it takes it with it. And that's kind of the prayer I say to myself when I'm in there. And so water is very sacred to me too. And that's kind of the connection I've made this year.
And I'm so proud of you for doing that. Congratulations.
Thank you.
Taloa?
Well, I used to be hiking. I like to be outside. Me and my husband have gone hiking everywhere. And that's how I feel like I just stay grounded. Here recently, though, we haven't traveled so much, and the weather's just been too cold, too windy. So I'm hoping the weather will come back around to where we can get back outside. That's why I went outside today, because it's a beautiful day outside today. But that's what I like to do, is to be outside. It just gets my thoughts all aligned with what I need to do. It kind of brings me back to balance. But it's funny that you would ask that too, because another younger nurse at work, and I feel like that's important to talk about too. She was having work in the ICU setting, and she's non-native, and I feel like me and my husband are like I say the mom and the pop of the unit, because we're the tenured nurse, one of the tenured nurses in the unit. So she came to me and she asked me if she could talk to me, and I said sure. But she was having a hard time dealing with all the deaths. She had a lot of death with her patients over the past 3 or 4 days, and she had come from the ER setting where you don't get emotional, you don't have emotions. This is task related. So I feel like it's important too. And I told her that to talk to each other, because that's what me and Sonya do a lot too. We have our time to ourselves, and we try to have somewhat of boundaries with our family, if that even is a thing with Native families. But I think it's important too that we have our support systems even in the places that we work. And even outside of that work, the work that we do outside of work, because me and her talk, and then I have my people at work. They know they can come to me, and I encouraged her, if you don't feel like that weight is lifted enough for you to get it off of you, because you can't take that with you all the time. It's heavy. You care about people, and don't ever think that that's a bad thing. You have a heart, and to get emotionally attached to them, it's perfectly fine, but you can't take that with you. So find a safe way to take that weight off. And I said, if it's not enough that you can come talk to me at any time, and I'll pray with you. I will sing prayer songs with you. I told her this. I said, whatever it takes. But if that's not enough, always feel free to find a counselor, find a therapist, find someone that you have that outlet, or find some way outside of work that you let those things go and you don't carry them with you always. So that's kind of what I do too, is just have my support systems in place.
Oh, I love all of that, and definitely want to highlight for the listeners, right, that it's okay to seek that counsel, that help, right, from colleagues, peers, family members, but also, right, it's okay if you need to seek professional help. And a lot of healthcare organizations have a benefit called Employee Assistance Program, where it's usually free for you to speak to a therapist about a topic, and it's confidential as well. I always plug in EAP. I've been in therapy for a while now, really grateful for it. And that's something else that I always normalize and champion is like, yeah, I'm in therapy and it helps me. And my therapist and I are growing and I'm learning. Because unfortunately, especially in my culture, it's very stigmatized, right? And in others as well. And that's something that I am very proud to help destigmatize and to break that out of kind of people's thoughts and mind frame. Sisters, again, this is not enough time. I feel like we can go on forever. And we didn't even get to like 3 other questions. So that just means we have to have you come back again for part 2. But with that, as we wrap up, just what is your call to action to the listeners, to the Nurse Converse, Nurse.org family, right? Because we're family. What are you going to ask of the relatives that have been listening to us today? And Taloa, I'll start with you first.
I would just say to, just like you mentioned a while ago, to find your place, because there's work to do. And that's what we always say about every meeting that we have every month with the OINA is there's work. You just have to find where you fit in that place. So reach out to the association. I had another nurse recently reach out to me, and I told him, I said, I can find you something. We got something for you. We have plenty of things that we can find you to do. If you're willing to devote some of your time. So it does take time, but there's sacrifice always when there's a bigger picture to see that's going to be good for everyone. I'm trying to think of the words. It's like I heard Dr. Katie say it, and I used it in a paper recently because when we all work together and we find our place and we're plugged into where we need to be and just be ourselves, all boats rise. So all of us benefit.
And Sonya.
Well, that's what I was going to say. So ditto to what Taloa said. But I would just add to actively advocate for those that you love, because nursing is advocating. And whenever you feel that in you that you need to speak up and use your voice to help another relative, then do it. Don't be afraid. You got to have that courage to do it. And a lot of us, we weren't born with it. We just had to learn how to do it. Just don't be afraid. Be strong. Be strong.
With that, I'll just add that I believe in everybody, your passion, your potential. So I believe you can do it. You can do hard things and you're not alone, right? Like, know that there is at least one other person that has probably very similar experiences and or aspirations and wishes that you do. So just gotta be brave and go look for them and be open to when you meet them. So again, sisters, such profound and rich history and experiences you share with us. We are so grateful for you and all that you do. Listeners, please make sure you check out the article because we'll have links to the organizations and some additional information regarding Indigenous nurses as well as communities. So we want you to explore all of that on Nurse.org. Again, I am deeply grateful for you both. Thank you so much. I will talk to you soon.
Thank you for having us.
Okay.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.